Welcome to this episode of Youth Diary. Today we have with us Dr. Rajesh V, who is Chief Pulmonologist of Rajagiri Hospital, Aluva. Welcome to the show, sir.
Hello.
I think smoking and use of tobacco products is a widespread problem in Kerala. So, Doctor, you wanted to say something about this?
Yes, as you correctly said, the usage of smoking as well as other tobacco products is on the increase on many states of India, including Kerala, and more widespread in the youth subjects. There are multiple reasons for that. The first one being that many of the youth are actually not aware that these problems, the problem consequences related to smoking will happen to them. And secondly, it has a lot of addictive substances that even if they want to give up the habit of smoking, they are not able to do that. So these are the two probable reasons that many of these subjects are not able to come out of the habit of smoking.
These days, again, smoking is a very common habit, So how can we help someone give up that habit of smoking?
It's not very easy to give up the habit of smoking. First of all, the smoker has to be extremely motivated to give up the habit of smoking. And in such a case, as a doctor, we can do some assistance to give up the habit of smoking. We basically can do a couple of things. We can give some drug assistance which will help the patient to give up the habit of smoking, as well as we can give some counseling assistance by which the patient can actually be motivated about the harmful effects of the substances in tobacco smoke, as well as some tips to give up the habit of smoking. When it comes to drugs that can help the patient to quit smoking, a couple of things worth mentioning are nicotine replacement therapy in the form of nicotine chewing gums or nicotine patches, and a new drug that's available in the so-called varenicline, it's called in medical literature, which actually makes the patient less crave for tobacco and smoke products if he actually stops smoking.
So let's move on to the next query.
Hi doctor, I'm Piyush, I'm from Kusat. Is lung cancer a disease of old age?
Yes, lung cancer is another respiratory disease that is really on the increase. As I said, smoking is rampant, and smoking is one of the major risk factors for the development of lung cancer. Now, non-smokers can also develop lung cancer. There are factors other than tobacco smoke that can cause lung cancer, but by and large that is a minority. Now, coming back to the question whether lung cancer is a disease of old age, I won't necessarily say it's a disease of old age, but it's less common or extremely unlikely in children and adolescents. So the majority of lung cancer in India occurs after the age of 35 to 40 years. Even ladies become affected. Lung cancer can manifest in multiple ways, like it can just present with worsening of cough or shortness of breath. It can present with spitting of blood. It can just present with loss of appetite, loss of weight, and general wasting. It can even present with manifestations outside the lungs, like somebody can have distension of the abdomen or bone pains or even fits and brain manifestations. The problem with lung cancer is that it manifests quite late. It has a long period when it slowly grows but doesn't really give you any clue to the existence. So the motive of the day is to actively find out whether someone has lung cancer. In such ways, screening programs for lung cancer can do some help for early detection, and that way better survival of lung cancer patients.
So talking about all dangerous diseases, I think pneumonia is one which cannot be ruled out, always. So how dangerous is actually pneumonia, and if you can tell us something about it?
Yeah, pneumonia is one of the most dangerous diseases of the respiratory system, I would say. Pneumonia literally means infection of the lungs with organisms, that is microorganisms, most commonly bacteria, but it can be virus, it can be fungus, it can be other microorganisms, but by and large it is infection of the lungs by harmful bugs. It is definitely dangerous in the sense it doesn't really give us time to detect and treat if that crunchy small period of time at the initial part of the disease is circumvent. That means the patient presents with symptoms like fever, cough, sometimes shortness of breath, all those stuff, and the real window of opportunity will be around 2 to 3 days where you detect that this could be a pneumonia. The problem even with a doctor is that many of the simple respiratory infections like throat infections, tonsillitis, pharyngitis, bronchitis, all this stuff present with similar symptoms, and it becomes a challenge to detect pneumonia or differentiate pneumonia from these conditions which are not actually that dangerous.